I'm Bob Jacobson. I'm the medical director of the Population Health Science Center at Mayo Clinic. It's part of the Robert D. and Patricia E. Kearns Center for Science Healthcare Delivery at Mayo Clinic. And I'd like to talk to you about our article today that we've published in the Mayo Clinic Proceedings entitled Vaccine Hesitancy. It is very timely, not just with the discussions that have emanated out of the recent debate, but also discussions that led the year in 2015 with the outbreak of measles that began in Disneyland and Orange County in California. A lot of people have been talking about vaccine hesitancy, but we clinicians have to do something about it. And there's a number of factors that I'd like you to read about that have led to these issues of vaccine hesitancy that thwart our work with our patients and the parents of our patients. There's a lot of reasons for this vaccine hesitancy. For one, vaccines have a very successful record of eliminating the reason that we vaccinate for. And at least in the patient's minds, often they're wondering why we're still vaccinating if they're not seeing polio or diphtheria. And there's many more that I'd like you to read about in this issue. In addition, beyond concerns of what's causing the vaccine hesitancy, there are real things that we clinicians can do to address it. Many of these are what we call population health interventions. They include things such as adopting a sense that we will use every visit to evaluate a patient's vaccine status and bring that patient up to date if they need a vaccine that date. But beyond that, we can adopt strategies that use our office without us being present, such as use of nurse standing orders or nurse protocols to vaccinate patients without our direct orders or prescriptions, and take advantage of even brief encounters so that a patient can get vaccinated without scheduling a visit far in advance and having to make quite a day of the visit. In addition, reminder recalls. There's many more that I'd like you to read about in this issue that we've investigated in terms of what works and doesn't work. I recognize that vaccines are far more complex than the old days when we were only giving one or two at a baby visit, and where adults could go years without needing a vaccine. Now everyone needs a flu vaccine every year, but there's so many more complexities. So I've also outlined some really good resources that I'd like you to have access to and use in your daily practice. So please take a look at this issue of Mayo Clinic Proceeding, and particularly the article entitled Vaccine Hesitancy.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.